Place, Regional President and CEO of Avera McKennan in the University Health Center. And so he came and talked to our class today, and we're just going to ask him a few questions. So first off, looking to the future, what is your vision for the hospital, and how do you plan to adapt and grow to the ever-changing healthcare industry?
Sure. I think one of the things that Avera has started to do and will continue to do while I'm the CEO there is focused centers of excellence. What we do is very broad, but if you think about OB, or you think about cancer care, or you think about orthopedics, all of those different things, they're somewhat unique in how we get through the initial diagnosis, whatever the therapeutics are, and the long-term rehabilitation or whatever it is. So by having these centers of excellence, we're able to provide faster care, better care, more economical care by having those centers of excellence. So then we have to think through, well, how does that work then on the campus? Do we have the right things on the right places so that when the individual patient goes through that experience, it's intuitive, it makes sense for why I'm going to those things. So centers of excellence, integration of the campus, all that works together.
Perfect.
What do you see as the next biggest challenge for Avera? Obviously, COVID was a huge challenge going forward. Do you see that continuing to be a large challenge, or are there other things on the horizon?
Yeah, well, we were talking earlier today about black swans, and the fact is, I mean, something's going to happen. I don't know what it is. I'm certainly not omniscient, and I can tell you that this is going to be the thing. But I think that the challenge that we're going to have in healthcare is, right now our reliance is on simulation for maintaining excellence in many of our clinical skills. I think we're going to change to either at least augmented reality, if not virtual reality, for aspects of our training. And I'll give you the aviation industry. Now, I'll date myself a little bit here, but when I was a kid, the simulators that we used in aviation were very simplistic. And any pilot worth anything could pass any simulator that we had. Simulators today are way more challenging. I don't know how many pilots are in the room. But to maintain, at least for the major commercial carriers, to maintain your pilot and command sort of license, you have to do three things. You have to have a certain number of hours of flight per year on the version of aircraft that you're flying. You have to be able to pass a check ride with an instructor pilot. So it doesn't matter if you're the chief pilot for, pick your favorite airline. If you can't pass the check ride with an instructor pilot in your airline, you're no longer the chief pilot for your airline. And you have to pass the simulator. And the environments that you have to pass are pretty challenging. Well, in healthcare right now, we don't have that sort of technology. So for us to maintain what we're doing, it's all about continuing to practice. And the relatively rudimentary simulators that we have today, I suspect that in your lifetime for sure, we'll have really, really complicated virtual reality for maintaining exceptional care for everybody. So think pharmacists, think nurses, think therapists, think physicians, think everybody. So those that are going to do well in the relatively near future are going to have to be at the beginning, the entry phase of that, know what it's about, know what it's not about, and set themselves up for success, because that, I think, will be a decision maker for people.
And can you discuss a little bit your hospital's approach to community involvement and engagement?
Yeah, it's our core value of compassion. If you look at our free clinic or our medical support assistants, or the charity care that we give, we're balancing the changing environment, in particular in Sioux Falls. One of the statistics I heard the other day that I found particularly compelling, 20 years ago, 3% of the children in elementary school in Sioux Falls were first generation, second generation Americans. Today it's 40%. It's an enormous immigrant community, and they all come from different cultures, different experiences, different expectations. So meeting them where they are, how do we provide a healthcare experience that blends their expectations to what the normal long-time U.S. citizen thinks about it, and how do we make it a comfortable place, a comfortable space, a comfortable everything for that whole different divergent of cultures and expectations and experiences, so that all feel comfortable coming to us. That means putting clinics, putting locations that are also conducive to where people are convenient, or people find convenient to be able to get to it. So thinking through all those changes and making sure that we're there before it's needed, not after it's needed, so we're here to serve the community.
Wonderful.
In terms of the workforce, it continues to evolve. One of the things that we're doing at Avera now is virtual nursing. And I'll give you an example. Part of it's virtual monitoring. So there's some conditions, cognitive, like largely conditions, for which we have to have what's called a sitter. And it's just what you think it is. It's for people who are at risk of hurting themselves, largely from falling down, who don't remember that they're at risk of falling down. So think of any of your grandparents, for example, since I am one, and the cognitive changes that have happened over their lives. How do you trust them always to do what it is that you think that they should do? And as they become more and more cognitively challenged, largely because of age-related things, they can hurt themselves. So if you're in a hospital bed and you can't remember that you're supposed to stay in bed, and you get up, now you don't have the right kind of footwear on. Hospital floors are relatively slippery, so that we can clean them because all kinds of stuff goes on the floor. Helps do that stuff. So they trip and fall, and what happens then? They hit their head, and then what happens? Bad things happen. And so you have to have a sitter in there. It says, oh, no, stay in bed. No, don't pull that catheter out. No, don't do that. Well, it takes one person, 24/7, sitting in a room. Think about labor costs for that. So with virtual monitoring, we can have a single nurse monitoring 10 different people and giving, so now it's the auditory part, reminding people, hey, Ron, don't grab that. Hey, Ron, can I get you something? Why are you getting up? Can I get you something? And if they still get up, then we can send someone immediately into the room to help them because they're just not taking no for an answer, and they're going to get out of bed and they're going to try to do something. So we can change the labor costs using technology for things that are low value, you're sitting, but high risk, someone gets out of bed and falls and hits their head and all the consequences that come from that. So using technology, think through what are the tasks that are high value tasks, what are the tasks that are low value tasks. Is there a way to use technology to get into the space of low value tasks to make it now way more tasks that they're doing, which now makes it a high value task.
And finally, what are your key strategic priorities and goals for the hospital under your leadership?
Well, the first is understand the incredible growth that's happening in Sioux Falls proper and the metropolitan support area. Are we providing the services fast enough? Are we growing each of those capabilities fast enough to stay ahead of the demand, not lagging the demand? Second, are we mindful of the changes in the way practice patterns are happening, the technologies of new therapies, new medications, new whatever they are, and where it makes sense for us? Do we invest early? Does it make sense for us to lag a little bit behind because we're not going to have it for a while? And then finally, when it comes just to buildings where we can support all that, are we mindful of, not just in the Sioux Falls area, but in every community in eastern South Dakota for sure, but whatever that contiguous area looks like, are we partnering with the right organization so that in our mission to make a positive impact in the lives of people and communities, are we doing that in a way that provides real support to the people who need help?
Perfect. Well, thank you so much for speaking with us today, and I know all the students really enjoyed it. So
Yeah, thanks for having me.
Thank you so much for doing this for me.